We consider patients for surgery who have a serious problem with obesity and a lifelong history of failure with other means of weight loss.
The options for weight loss surgery include gastric bypass, the adjustable gastric band operation, or the sleeve gastrectomy. And all of these can be performed with a minimally invasive technique using laparoscopic surgery. No matter which operation you choose, the basic idea behind the operation is essentially the same. What we want to do is restrict the size of the stomach to a smaller capacity so that a patient can have a sense of satiety or satisfaction with a small amount of food, and therefore over the course of a day they take in fewer calories, and that's why they lose weight.
There were several important articles that came out in the last 2 or 3 years in the major medical journals that looked at two groups of patients, thousands of patients that had surgery, weight loss surgery, and thousands of patients that were medically managed or did conservative measures of weight loss. And the patients that had weight loss surgery, in average, were found to live 5 to 10 years longer across the board, those who did well as well as those who did poorly. And there are many reasons for this, but the most important reason is the reduction of what we call comorbidities, which are a long list of medical conditions that go along with people being morbidly obese. These range anywhere from type 2 diabetes to high blood pressure to high cholesterol, heart disease, and various forms of cancers. And so the reduction of these medical conditions along with successful weight loss cause people on average to live longer than if they hadn't had surgery to begin with. Along with the reduction in comorbidities associated with successful weight loss surgery are improvements in patients' quality of life. Obviously, a lot of this is related to the reduction in the actual weight. People feel better, they feel better about themselves, they can be more active, they can engage in other activities that they normally wouldn't have been able to do. And in general, it just leads to a better quality of life over the rest of their life. We don't consider the weight loss itself to necessarily be one of the most important advantages of weight loss surgery, although it is the most visible for patients and is what often attracts them to the surgery initially. But it is the weight loss in association with the healthier living, longer life, and better quality of life that really make this a life-changing surgery for many of our patients.
The process for preparing someone for surgery involves a lot of education and a lot of information that we convey. And there's a lot to learn to decide which operation is right for you. And we help you and guide you along the way if you're having trouble with that decision. But most people, once they learn how the operations work and what are the pros and cons of each operation, are able to make a decision that they feel happy with.
Like any surgical procedure, there is some risk involved, but we try to minimize risk and increase benefit to our patients, again, through our preoperative education and preparation program.
So to answer the question about drinking and smoking after weight loss surgery, in terms of smoking, the answer is quite simple. We cannot have our bariatric patients smoking cigarettes. It's terrible for their health, and there are some specific complications that can arise as a result of cigarette smoking, especially after gastric bypass. The specific complications that are most highly associated with smoking after bypass are the formation of ulcers that form at the connection of the stomach and the small intestine. And smoking leads to a very high incidence of ulcers, which can ultimately require another surgery. In terms of alcohol consumption, the answer is very different. We counsel our patients that they can drink alcohol in moderation. And the reason for that is that they may find that they are much more sensitive to the effects of alcohol, having a very smaller stomach and a changed metabolism. In addition, alcohol in some forms represents a liquid form of carbohydrate and calories, and we don't advise any of our patients after weight loss surgery to consume a lot of liquid carbohydrate calories. So patients have to be careful in terms of the calorie consumption aspect of alcohol. But consumed in moderation, alcohol can be taken by our bariatric patients, and many do so and enjoy it.
Getting back to work is a very common question. You know, how fast can you get back to work after a major operation? It really depends on a lot of different factors. It depends on what kind of surgery you have. It depends on how well you're recovering from the operation. It depends on what your job duties are and how you feel. And so we tend to be very flexible. We work with patients individually, and somebody might be able to get back to work within a week or two after the operation, and somebody else might require 4 to 6 weeks to get back to work. And we try to adjust that according to the patient's individual needs.